Hello everyone, welcome to our channel. Every day, billions of cells in our body divide to keep us alive, but sometimes this process goes wrong and may result into erroneous cell division. Welcome to Carcinogenesis. In this, we have discussed about how cancer cell develops. So, by definition, carcinogenesis is a multi-step complex biological process by which normal cell undergo genetic and epigenetic changes over time to become cancerous. So a normal cell become a cancerous cell, and this process is known as carcinogenesis. Carcinogenesis is a multi-step complex biological process which involves genetic and epigenetic changes in a normal cell. Carcinogenesis has a broadly three steps. First is initiation phase, second is promotion phase, and third is progression phase. Normally, a normal cell exposed to various environmental insults like exposed to radiation, chemicals, various infection and metabolic insults, these may result into genetic mutation. After the genetic mutation, normal cell harbor some mutation and result into a mutated cell. Mutated cell in a promotional phase harbor some additional mutation and will result into a malignancy or tumor formation. So what is a carcinogen? Any physical, chemical or biological agent that promotes the formation of cancer by causing mutation or damaging the DNA or by disrupting normal cell regulatory mechanism. So any chemical, physical or biological agent that promotes the formation of cancer is known as carcinogen. A normal cell, whenever exposed to a carcinogen, converted into a cancer cell. Carcinogen can be a physical agent like radiation or a chemical agent or in various infections or metabolic insult. In this, first we discuss about the chemical carcinogen. How a chemical can act as a carcinogen and will result into cancer formation. A carcinogen, by a metabolic activation, converted into an electrophilic intermediate, which by detoxification can be excreted by kidney, or carcinogen directly can be detoxified and excreted by the kidney. This electrophilic intermediate bind to DNA, RNA and various cell protein to cause a mutation or a changes in cell regulatory mechanism. Normally, whenever there is DNA repair, cell undergo to DNA repair and act normally, or if the DNA repair is irreparable, then cell activate the process of senescence or apoptosis and result into the cell death. Whenever these mechanism of DNA repair and cell death overwhelm or mutation of the gene involved in these two processes, the mutated cell persists and result into the formation of initiated cell. And this entire process from exposure to carcinogen to the formation of initiated cell that harbor a permanent damage is under the initiation phase. This initiated phase cell further proliferate and harbor additional or exposed to some additional mutations and form the pre-neoplastic clone, which further exposed to mutations and will result into the malignant neoplasm. B. Now we will discuss about the various chemical carcinogens. They can be directly acting chemical carcinogen or indirectly acting chemical carcinogen. As the name suggests, directly acting chemical carcinogen do not convert or do not make an intermediate to act as a carcinogen. In this category, we have alkylating agent like beta-propiolactone, dimethyl sulfate, diepoxybutane, anti-cancer drugs like chlorambucil, cyclophosphamide and nitrosoureas, and acylating agents like acetylimidazole, dimethyl carbamyl chloride. In the other category of indirectly acting chemical carcinogen, they first need to convert into an active intermediate or metabolite for the process of carcinogenesis. In this category, we have polycyclic and heterocyclic aromatic hydrocarbons like anthracene, benzopyrene, 3-methylchloranthrene, aromatic amines, amide and azodine like 2-naphthylamine, beta-naphthylamine, benzidine, 2-acetylaminofluorine, dimethylaminobenzene. In natural plants and microbial products, we have aflatoxin B, griseofulvin, sikasins, saffron and betel nut. And in others, in indirectly acting chemical carcinogens, we have nitrosamine, amides, vinyl chloride, nickel, arsenic, chromium, insecticide and fungicide. So majorly we have discussed about the two categories in chemical carcinogen, directly acting and indirectly acting. Now we will see the various chemical carcinogen and associated cancer. Although these are the use list, you need to keep on revising and to better memorizing these chemical carcinogens, as direct question can be asked from these lists. So chemical carcinogen and associated cancer. Aromatic amines like benzidine, 4-amino-biphenyl associated with urinary bladder cancer. Arsenic is associated with lung, skin, bladder, kidney and liver cancer. Asbestos is associated with lung cancer, mesothelioma. Benzene associated with leukemia, particularly AML. Formaldehyde associated with nasopharyngeal cancer and development of leukemia. Vinyl chloride associated with hepatic angiosarcoma. Chromium, exposure to chromium may lead to lung cancer, nasal sinus cancer. Tobacco consumption may result into lung cancer, bladder cancer, pancreatic cancer and larynx cancer and cervical cancer. Chronic consumption of alcohol may result into cancer of the oral cavity, throat, liver, breast, colorectal cancer. A betel nut consumption may result into oral and esophageal cancer. Exposed to silica may result into lung cancer. Exposed to nickel may result into the lung and nasal sinus cancer. Polycyclic aromatic hydrocarbon exposure may result into skin, lung, bladder cancer. Alkylating agent like cyclophosphamide may result into the development of some leukemias. Diethylstilbestrol uterine exposure may result into cancer of vagina and cervix. Immunosuppressant agent like azathioprine may result into the lymphoma and skin cancer. Aflatoxin may result into the liver cancer. Nitrite consumption may result into the colorectal cancer. Androgen exposure may result into prostate cancer. Estrogen exposure may result into cancer of endometrium and breast